The other midline muscle, which I said is inconsistent. Why is it inconsistent? Because it can be absent in as many as 70% of the population on either one or both the sides. It is a smaller muscle which is present only in the inferior part, and it is a triangular muscle, and it lies between the anterior surface of the rectus abdominis and the anterior sheath. Now, it originates caudally from the pubic crest. So these are the small pyramidalis muscles. They originate inferiorly from the pubic crest and insert into the linea alba. The function of this inconsistent muscle is not well understood, and therefore it is not of a very important clinical significance. Now we come on to the lateral muscles, of which the most superficial is the external oblique muscle. And you can see the external oblique muscle starts from the external surface of the 5th to 12th ribs and runs in a direction which is downwards, forwards, and medially. So in the anatomy classes, the direction of the fibers is classically taught as the direction of your fingers when your hands are in the trousers. So in the pockets of your trousers. So when your hands are in the pockets of your trousers, your fingers are directed forwards, downwards, and medially, and likewise is the direction of the fibers of these muscles. They insert along the outer lip of the iliac crest and then at the lateral part of the inguinal ligament as well. Now, as the muscle traverses medially, the muscular fibers get converted into aponeurosis, and this aponeurotic part of the external oblique contributes majorly to the formation of the anterior rectus sheath, which is the anterior lining of the rectus abdominis muscle. It also, the lower incurved part of the external oblique, also between the ASIS and the pubic tubercle, forms the inguinal ligament, and an aperture within the inguinal ligament through which the spermatic cord emerges out to traverse into the scrotum is known as a superficial inguinal ring. The vascular supply is from the intercostal arteries and the deep muscular branches of the deep circumflex iliac artery, and the nerve supply is from basically the nerves which are supplying the rectus abdominis, that is from T6, T7 to L1.